Spinal stenosis is a leading cause of pain, disability, and loss of independence in people over the age of 65. Our next guest is hoping to help over 200,000 Canadians who suffer from this condition. Dr. Carlo Amendolia is a chiropractor and associate scientist at Mount Sinai Hospital. His boot camp helps people who live with spinal stenosis, people like patient Lillian Goldstein, who came in this morning to talk. And thank you both for coming in. This is really, so stenosis, when you talk about stenosis, I mean, and debilitating pain, what is it in the spine?
Okay, well, spinal stenosis refers to a narrowing of the openings or the canals where the nerves travel from the spine down into the back and into the legs. So it's this narrowing that ultimately gives rise to pressure on the nerves. And the most common cause is a wear and tear type of arthritis that we all get as we age.
As we age.
Exactly, but some people get it more than others, and the longer we live, the more likely we're going to get this kind of wear and tear arthritis that causes constriction or narrowing of this opening and then causes pressure on the nerves and causes debilitating back and leg pain, numbness, tingling, and impacts people's ability to walk, to stand, and to function.
So other than pain pills, there's no pill that cures this?
Well, there are a number of medications that have been used, but none of them have been shown to be effective right now. Yeah.
So let me ask you, Lillian, tell me about your life with spinal stenosis, how you dealt with that.
Well, I started by trying to find medications, creams, then I started going to my doctor and did MRIs, nerve conduction tests, and different chiros, acupuncture, until I was fortunate enough and I found Dr. Carlo, and it changed my life. There's no question about that.
It changed your life?
It changed my life. I mean, I had difficulty, turning in bed, getting out of bed. From a very active individual, the pain became more and more debilitating. And I knew I couldn't continue that way, and the only other option for me was surgery, which I really was not looking forward to. So when I was able to see Carlos, and he'll explain his boot camp, the exercises, the stretches, which I do on a daily basis, I started to, the pain subsided, the movement began, I was able to function as a normal individual. And the key thing that people don't realize, you mentioned 65, I was in my early 50s when this happened.
Right.
And I think what happens is a lot of younger people are told to do surgery, and they do, and the older patients don't because they're too old. But this is also an issue for younger patients as well.
So, and Lillian is one of many patients who benefited from this boot camp. You designed it.
Right.
What is it?
Well, it's interesting. It's a program that actually doesn't use medication. It doesn't use surgery. It uses exercise, but very, very specific exercises that deal with the weakening of the muscles that occur in older people, but also trains patients. It's a training program, training patients how to realign the spine in such a way to make those canals that are narrowed larger. You see, patients who have stenosis tend to stoop forward when they walk.
Yeah.
They tend to lean over a shopping cart.
It's too painful,
but also because when they lean forward, the spine opens up and the canals get bigger. So that's why they do that. But instead of bending forward, we're teaching our patients to pull the spine upwards when they stand and they walk. In fact, we're teaching our patients how to stand and walk in a completely different way to maximize those openings in the spine. We're also testing manual therapy to see how that might actually improve the mobility of the spine. Also testing the spinal stenosis belt, where we're artificially changing the alignment of the spine, as well as devices to improve blood supply to the nerve when people stand, because when they compress those nerves, they decrease the blood supply to those nerves, and we're testing all these at Mount Sinai Hospital right now.
So specific exercises, stretches, this is a 6-week program.
Yes.
It's intense?
It's very intense. It's a 6-week program. Patients are exercising twice a day. They're on stationary bikes. They're building strength in their legs. They're building strength in their core and enabling them to self-manage their condition. This condition, there's no cure. It tends to progress over time. So patients have to learn how to manage this condition, and we've done some preliminary work that we just published, and patients are doubling, quadrupling their ability to walk by learning these specific exercises. And this is preliminary studies, and now we're doing clinical trials at the hospital to sort of bring more data on these programs that we've developed at Mount Sinai.
So after the boot camp, so you still do these exercises and stretches every day?
Every day.
Yeah.
And even when Carlos mentions that it's an intense program, you still do have a life. You still can go to work. You still function. So I don't want people to get intimidated, like I don't have time for this for 6 weeks. You definitely have time. And, you coordinate it within your life and you go forward. And even if you can't do it, all of it, even doing some of it, is amazing, the difference that it can bring. It did for me, unbelievable.
You've been doing this for quite some time, but as you mentioned, there's a clinical trial now underway. Right. So funding, but it's international attention now.
Yes.
Your program.
Yes, we've been publishing quite a bit on preliminary work right now, and there's been a great interest because this is a huge problem now in Canada. The next 15, 20 years, we're going to have 25% of our population will be over the age of 65, and many of them will be suffering from spinal stenosis. So a lot of people are interested Japan. I've been invited to Japan, invited to Europe, because they're all developing spinal stenosis program. We have one in the hospital now, one of the first, and we're teaching it around the world. Again, preliminary work. Some more work needs to be done, but we're very, very, very encouraged about the results so far.
Well, and certainly talking to Leanne, she's only one of many patients who've benefited. Thank you both for coming in to speak with us this morning.
Thank you for having us.
And if you'd like to learn more about the spinal stenosis study, you can head right to our website. There's a link there on how to find out more. Now, the mountain story.